Yeah, I mean, alcohol affects a lot of medical conditions, from their high blood pressure to their diabetes, their obesity, their sleep apnea, their acid reflux. And so it's an important thing to find out, especially when you've got patients with those conditions. And so asking a screening question, very open-ended, like how many drinks a week do you have? And if it's above what the safe drinking limits are that, I've got posted there on the bulletin board in my exam room, it's a conversation starter, not just that it's not good for their overall health, but that it's specifically impacting, one or several of their medical conditions. And asking patients to cut down when their physician is doing that and they can see the impact on these other conditions they've got is typically helpful. And I've had patients that I think have been very successful a lot in losing weight when they just reduce from the 3 or 4 drinks a day they were having maybe down to 1 drink a day. And they didn't realize the impact it was having, on their other health conditions. And so that's been, I think it's a very useful thing to do, as well as just as a screening question, even for your patients who are healthy. If we're trying to prevent them from developing problems, we want to identify if they're really having more than is a healthy amount of alcohol in any given week. It's true. When we see a patient in clinic, the patient is coming in with their agenda, and they've usually, often got a list or got some things on their mind that they want me to check and take care of, or referrals, or, something. And then the physician, I've got my own agenda, which is, is their blood pressure under control? Is their diabetes? Have they had all their screening tests? And so I've got my agenda, they've got their agenda, and often, alcohol issues or alcohol screening isn't anywhere on either of those agendas. But, at some point, if this is my primary care patient, over the long term, it's really in my best interest to identify, and the patient's best interest as well, to identify if there's an issue with alcohol. And just, the vast majority of patients you ask, probably 93% of them, the number is going to be fully within safe limits. It took me 15 seconds to ask the question or less, and I can move on. And for those that it's not within safe limits, it's a big red flag, because that's going to be affecting a whole bunch of those other conditions. Because blood pressure quality goal, if people are drinking more than about a drink a day, their blood pressure is going to be higher. Their blood sugar control, if they're drinking much at all, it's not going to be having a good effect on their hemoglobin A1C. And so, increased risk for breast and colon cancer, certainly related to alcohol consumption, we know. So it's worth asking the question, because it does impact all those other quality goals.